Good afternoon and good morning, everyone, and thank you for joining the webinar, How Sheriffs Can Support Federally Funded Justice and Mental Health Programs. We're going to get started in a few more minutes just to allow for some additional sign-ins past the hour. Good afternoon and good morning, everyone, depending where you are. And thank you for joining us for the webinar, How Sheriffs Can Support Federally Funded Justice and Mental Health Programs. This webinar will be a virtual panel format and is exclusively for Justice and Mental Health Collaboration Program, JMHCP, grantees. My name is Mark Stovell, and I'm a Senior Policy Analyst here at the Justice Center, and I'll be moderating today's webinar. For an overview of the webinar today, we'll start with some introductions. Then we'll hear from each of our sheriffs on the panel with us today about their JMHCP programs. And then I, along with Carrie Hill from the Massachusetts Sheriff's Association, will facilitate a discussion with the sheriffs about how they got their grant programs up and running, what challenges they encountered, and the advice they would give for grantees who want to strengthen their relationships with their local sheriffs. And at the end of the webinar, we'll have time for questions and answers from the audience. And we're very excited to have 3 sheriffs with us from different parts of the country for some geographic diversity. And they have wonderful and storied careers, but in the interest of time and for giving the sheriffs more time to talk about their programs, I'm going to dispense with reading their bios. But a big thank you for all the sheriffs joining us today. We have Sheriff Kevin Coppinger from Essex County Sheriff's Department in Massachusetts, Sheriff Dennis Lemma from Seminole County Sheriff's Office, Florida, Sheriff Ian Parkinson, San Luis Obispo County Sheriff's Office, California, and Carrie Hill from the Massachusetts Sheriff's Association. And before I move on, some quick housekeeping items. During the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen, and we'll respond to the technical questions as we go, and we'll keep a running list of the content-related questions and hold them until the end for the Q&A session with the attendees. And for some brief information on the Justice Center, which I think most of you are already familiar with, we are a national nonprofit, nonpartisan organization that develops research-driven and consensus-based strategies to increase public safety and strengthen communities. And we engage in consensus building, original research, policy change, and providing expert assistance at the intersections of criminal justice and behavioral health. And our goals are to break the cycle of incarceration, improve health, opportunity, and equity, and expand the knowledge base of what works to improve public safety. And the Justice and Mental Health Collaboration Program, JMHCP, as I think most of you know, supports cross-collaboration between criminal justice and behavioral health entities to support people in the justice system who have mental illness or co-occurring substance use disorders. And the Bureau of Justice Assistance, or BJA, is the funder of JMHCP grants, and here you can read their mission statement. And now I'm going to turn things right over to Sheriff Parkinson from San Luis Obispo County to introduce his jurisdiction and his JMHCP grant project. Sheriff?
Thanks, Mark. And good morning to everybody that's out there. Just a little bit about San Luis Obispo. We are located on the central coast of California. We have about 100 miles of coastline. It's about 3,600 square miles. The Sheriff's Department is the largest law enforcement agency in the county, and we have 7 cities within the jurisdiction as well. So it's kind of straight to the topic here. So in 2018, we applied for and were granted the JMHCP grant implementation between 2019 and 2020. So our focus was on the framework of stepping up. So it included the planning and implementation guide and data collection for 4 key measures and development of a dashboard, which was probably our most difficult part of the process, getting that started and getting everybody together on the same page. But we were successful in developing that framework and dashboard. And then also develop our countywide strategic plan. It was kind of interesting the way our process began. We had already kind of gone down that road slightly with identifying stepping up as something that we really wanted to engage in and be part of. But we were missing some kind of key components. So one, I think, was direction. So I think the grant allowed us to help identify and track and of course, with the goal of reducing SMI in our county jail. I think most sheriffs that at least the ones that have jails recognize that we have had a very large SMI population. And we are kind of, as I always say, the can's been kicked down the road and we're the last stop. So we were kind of forced to deal with the problem when it's really not our expertise, and looking for guidance and looking for direction. When stepping up came on the forefront to us, it was very appealing to me because I realized how much manpower and energy we put into dealing with the population, and particularly the cases that we, collectively believe do not belong in jails, yet we were kind of forced to deal with the problem. So having some guide to helping us was pretty critically important. Next slide. So as I mentioned that, collecting real-time data was the biggest struggle for us. So early on, we not only have to deal with federal law, but California has fairly strict law in regards to sharing of data. And so we were really involving these partners in trying to come up with common ground of how we're going to get this information to one source and be able to track it. And particularly as the data changes, that we wanted it in real time, because it really didn't do us any good to go back and take a snapshot of how the jail looked a month before. So actually finding that or obtaining that data was pretty crucial. We developed a system that we involved all of our partners, particularly in the area of medical and mental health, because that segment was the most difficult to break. California, under our laws for criminal justice, had some criteria, but we were able to navigate those pretty quickly and pretty easily. And then also then making the data usable, and certainly when you haven't explored that before or tracked the data, getting your IT department on board and helping you kind of identify the areas you thought are kind of critically important is what we set out to do at the very beginning, and we're actually really successful. As we know, the program's bigger than just data, but data is the starting point, and the grant allowed us to move forward with being successful in getting that information. In addition, we've done a number of different things within our county that have gone hand in hand with that data, and really improved our knowledge and really set goals for us in the future. So just to mention a few of those, first jail bed competency program. Jailbed competency program. So the state of California deals with state hospitals, and the state hospitals are, I would say, probably few and far between. We don't have enough, and certainly with a growing mental health population to be able to deal with it. On the local level in California, if somebody is charged with a misdemeanor and they're determined by the court to be not competent, they're restored locally at the county mental health facility. But on the state level, they are sent to a state hospital. Well, there was a backlog at one point in the thousands waiting to get into state hospitals. And so the wait time to get somebody in with SMI was 3 to 6 months. So in the meantime, they would be in custody and really kind of, I would say, languish a bit because of lack of services to them for those needs. So I had heard about the state contracting. They'd contracted with a couple of our larger jails, or largest jails, Los Angeles and San Bernardino, to contract to do their own program. And so we reached out and were able to enter into a contract to do our own jailbed competency program funded by the state, to really, once the person with SMI was identified by the court, that we would start the restoration process in our facility immediately. So it's a separate unit in our jail that treats and restores inmates. It didn't prohibit us from sending to the state hospital, but we've been extremely successful with restoring people quickly and then maintaining them, which was important because we'd send people away to a state hospital, they'd be restored, they get sent back, and if they didn't have an immediate court date and or immediate treatment plan, they would decompensate pretty quickly and we'd be back to square one. So this allows us to maintain them if they are in state hospital or they're restored locally, and it's been extremely successful with treating our SMI inmates. Next was our behavioral health incentive program, and I just want to mention on this, and you're going to have 3 sheriffs here discussing their view, and I'll mention from my point of view, it's pretty critical to have the sheriff on board with this and really want to be part of a solution in your facility, because without it, you're really fighting an uphill battle, and so it's incumbent upon everybody that is pushing for that is to educate your sheriff on the facts that you're dealing with, and not to say that they're not educated, but depending on the size of the agency or their exposure to it, they might not be fully aware how incredibly costly it is to care for this population. So what I found is once I started pushing this agenda and pushing this message, and as we started going down this road, that I had employees that were in the facility that really had a strong interest in this. I mean, we were traditionally just dealing with the security of the facility, and as we went down this road, I had employees, deputies that had been employed for many years in the jail that really wanted to get involved in dealing with this specific class of inmate. So that was very helpful as they started kind of announcing that. It became more and more successful and popular. So we created a mental health unit, and all the deputies that work in that unit are hand selected and actually put in to work in the unit, so that they're very willingly and wanting to cooperate or wanting to help SMI, particularly inmates. But what I found is they were coming up with their own ideas. They were approaching me with ideas all the time about, hey, what about trying this? What about trying that? Well, it was a big step to move all of our mental health inmates into one wing of the jail. I literally left my office on a Friday evening expecting that when we made the move, and expecting that the whole weekend was going to be filled with calls of problems, because a lot of the inmates we were dealing with, and particularly our SMI inmates, were 2 officer moves and could be highly violent. And so we took a kind of a big step forward to do this. And I went through the whole weekend without a single call. And of course, I come in Monday morning. I normally get in my office about 6:30. Immediately went to the jail to find out why I was not being told about the problems that they were having, and found out that they had zero problems. As a matter of fact, they were excited because the success they had in the jail. And so as a result of that, they wanted to institute a incentive program. And so essentially what that is, we've all had inmates over the years that, they want to litter their cell with trash, cover their window, not make their bed, not take medication, not eat, everything imaginable. Well, they wanted to do a program that gave them incentives for doing all these things. So we gave it a shot. Not only did we find it highly successful, but the inmates that are our biggest problems ended up being the ones that were complying the most with doing the things that we really needed them to do. And so it really took these black and white, striped two-man move inmates and moved them back into their orange uniforms because of their cooperation level change. So really what it is they get points for doing things right and cooperating, and in return they get to use those points to select things from the commissary, that they get to enjoy for free. So it turned out to be highly productive. The next would be our community action team. We call it a CAT team. But I implemented this about almost 3 years ago now. And really what it is we have two deputies that are teamed up. Their partner is mental health therapists. They work in the field primarily dealing with people in the community that are repeat offenders to us, that are continuing issues, to try to get them treatment and programs and deal with them in a kind of I would say, much more therapeutic way than in law enforcement coming to their home. And then they also have responsibility for transition from an inmate that came into custody and is going to be released, of getting them to services and really helping them stay out of jail. Because ultimately, most of these people that we identify with SMI that come in contact with law enforcement end up coming into jail. So the idea is to keep them out, and we do that by partnering with our field team to help get them the services and continue that relationship that has ideally been built in custody. And then the last one I'll mention is our crisis intervention training. The state of California is regulated by Police Officer Standard and Training Post, we call it. Like many states, we have regulation on our training. The current criteria or requirement for CIT training for the state of California is 8 hours. I implemented a 40-hour mandatory course for not only our people, but we teach all law enforcement in the county. This has not only proved highly successful, but I've actually invited, I'll say, a couple of critics of law enforcement, and particularly when it deals with mental health, to come sit through the course. And I've told them all the same thing. I'll let you sit through the course, and at the end of the course, you can come to me and you can tell me where you think we're deficient or where the course is weak. I have not had one single person that's gone through that course that has come to me with a single thing. As a matter of fact, they've praised the course both publicly and privately to me, and offered no suggestions because of what we offer. So really the idea with crisis intervention training is our push for law enforcement, particularly I'll say the police departments, because it's easy for me to preach to my deputies on the street, hey, if you have somebody in crisis, don't bring them into jail for a trespassing, get them to the mental health facility. Don't solve your problem by using the jail. But it's much harder with the police departments because I don't have that control over them. And so pushing them through this course and pushing that philosophy of not having this revolving door and pushing for solutions as opposed to the jail being the solution has been, I think, pretty successful. So we've been pretty pleased with all the changes we make, and it's fluid. Day to day, waiting for other ideas or or suggestions, and we're continuing to, kind of work through change. And I'll just end with, it really goes back to being awarded this grant and having a structure put in place that helps us identify and track it. So thank you.
Great. Thank you so much, Sheriff Parkinson, for that overview. And that was really helpful to hear about all those different programs that support the SMI population in your jail. And next up, we have Sheriff Dennis Lemma from Seminole County, Florida. Sheriff?
Well, thank you, Mark, and thank you for the opportunity. I tell you, we were very, very excited about receiving this award back in 2017. And a little bit about the Seminole County Sheriff's Office. We're in the Orlando metropolitan area. We are a relatively small county geographically, at 309 square miles, but a population of a 500,000. We have an agency that consists of 1,400 members. And we perform really, really holistic services when it comes to traditional expectations of policing. Like, in addition to being the largest law enforcement agency with full service law enforcement services, we run our correctional facility. We run our county juvenile detention center, which is the only county in the state of Florida that runs our own juvenile detention center. Most areas run that function to the state. We are one of 6 counties that perform child protective investigations. We take exclusive responsibility for abuse, neglect, or abandonment. Within the past couple of years, we've taken on the responsibility of county probation and code enforcement and a lot of non-traditional things that would be vested with other offices. When we had the opportunity to receive the $73,000 for exploring whether or not, we could really use and benefit from this, it was almost immediately through our partnership with the University of Central Florida that not only did we benefit from this, it really fit to our fundamental philosophy of addressing crime as a symptom of another problem. We have long thought that the most significant thing that we can do about crime is to prevent it from occurring in the first place. And as my 30 years in the business, I've never met somebody who's born that has the desire in life to be a career criminal and spend their entire life in prison. Usually it's poor parenting, it's substance abuse, it's mental health, and that mental health component is what really, really attracted us to look at this. We were ultimately awarded the $750,000 for a 3-year initiative, and we hit the ground running specific to our youthful population. In this business, we throw around a lot of sophisticated words, and with the Department of Corrections, recidivism is one of those words that we talk about. But in the pure sense, recidivism, it's reflecting that constant cycle. And we talk about rehabilitation, but if you think about rehabilitation, what that word means is make what it once was. And I think that any one of us that have worked in this business for a day or two understands and recognizes that some were never right in the first place, that little boys and girls that are involved in the criminal justice system have no choice who their mommies and daddies are, and sometimes they're given an unfair shake at life, which in our jurisdiction led to a high level of Baker Acts, those co-occurring prevalent mental health issues that ultimately lead to ancillary types of crimes. And we know that if a child suffers from those mental disabilities or challenges, they are 8 times more likely to engage in maladaptive behavior later in life. Ultimately, they end up filling our adult correctional facilities in our state prisons unless we do something to address that in early stages. So we were able to receive the $750,000 grant for the 3-year period to really partner in a very, very unique way with our Crisis Mobilization Center and make sure that we collaterally respond to every single situation involving a youthful offender, particularly concentrating on those ones that may have been documented in the past of potentially being Baker Acted. Almost immediately after we initiated this new partnership with collateral responses with healthcare professionals, mental health specialists, as well as law enforcement officers, we experienced an 80% decrease in the amount of Baker Acts. We experienced an 80% decrease in the amount of and then a significant decrease in the level of recidivism specific to youthful offenders. We also had the opportunity to capitalize on the grant funds to provide a widespread training opportunity, not only to the members of our agency, but to all of those other stakeholders. When we look at wraparound services, whether it's the school system, mental health providers, all of these individual people who have to actually come together to protect and preserve, is something that we're now providing those opportunities from them. It's been a tremendous asset, again, for the 8 municipalities as well as the sheriff's office, because we provide these services not only to our jurisdiction, but anyone within the neighboring city jurisdictions as well. I think that some of the challenges we've had is not unique to us, but I think that the unintended consequences of COVID-19 has increased the demand and dependency on social services. Kids that were suffering from mental health or substance abuse disorder have only turned at a greater level to those same substances as stress and the isolation has occurred. Here in Florida, we're in a kind of a midst of this outbreak right now, where I think a majority of the kids are still not going to schools. And we've seen some of the numbers go down in terms of the amount of reported abuse, neglect, and abandonment of children and other types of things. But the most horrifying facts are, we know child abuse has not decreased, but direct access to those mandatory reporters, those school teachers, or those other individuals that may be engaged in a more social environment with these kids have a less of an opportunity to really pick up changes in behavior or ask what's going on. So we're seeing some of the challenges that we're facing right now with that. But again, we're so excited about this. Our team has already, have trained more than 45 members of our local law enforcement team and community. The collateral responses is building lasting relationships with our citizens, and we're very excited to reapply for an extension of this grant as soon as we get the opportunity. I think when we look at it, it's the new way of law enforcement, right? Treat those underlying conditions that are present that lead people down the path in the first place. And not only do you make your community safer, but you ultimately save lives. And I think that's what we're doing here. Something that we're very proud of. We also are opening a new Hope and Healing Center, which is a very unique opportunity. Not only do we partner with the university in this grant, but we convinced a local healthcare provider to open up this Hope and Healing Center, which is a $1.5 million contribution completely funded by the private hospital chain. They're directly across from our a correctional facility and directly next to our juvenile detention center. And this is going to be a one-stop shop for all services, from mental health and substance abuse at no cost to the individuals. To the individual families that have insurance, we're going to help them navigate what benefits are available to them. But ultimately, in a state that does not have expanded Medicare and Medicaid, we're going to make sure that we provide the help and the services to the citizens that need it the most. This was so attractive to the private sector that executives from Walmart came and gave me a check for $500,000 to help support some of these initiatives, and told me that they would be back next year again with another check for $250,000. So if you take the award of the grant, the collaboration with our school system, our mental health providers, our community-based care, the fact that we are the primary service provider for abuse, neglect, and abandonment, and the prevalence of co-occurring disorders with mental health and substance abuse, you can see the success that we've had, throughout our community. And I encourage anybody who is looking for an application on how to use this, catching it during the most infinite stages of a person's life is probably the most desirable area to focus on it. So with that, I know I'm limited on time. I'll yield there, but thank you for giving me the opportunity to kind of share a little bit about what we're doing here at the Seminole County Sheriff's Office, and we're blessed to partner with the Police Mental Health Collaboration.
Thanks so much, Sheriff Lemma, for that overview, especially hearing about responses to the juvenile side of things. And I actually have one quick follow-up question. What is the Baker Act? Could you explain that?
I'm sorry, I forget I'm talking to a national audience here, but the Baker Act is the involuntary commitment of a person because they have demonstrated suicidal tendencies or homicidal tendencies. So it's an effort that is initiated by a law enforcement officer or a medical professional that basically takes a child into custody for a 24-hour evaluation period. That's primarily what we do when we have those children in crisis that we find out there on the streets. There's ex parte orders that their parents or guardians or loved ones can petition the judge to do. So you can imagine that when a child was normally being taken into custody, now because of this grant and this new opportunity, about 80% of those people that would normally be involuntarily taken are now receiving the appropriate and adequate counseling services there at their home on the streets.
Great. Thank you so much for clarifying. And then next up, we have Sheriff Kevin Coppinger from Essex County, Massachusetts. Sheriff Coppinger.
Well, good morning or good afternoon, everyone. I appreciate you taking the time to listen to this webinar, and I thank the CSG for hosting us. I applaud my fellow two sheriffs who just talked about their programs. It's all excellent opportunities to address the mental health status, because I do think that's a major factor in what we do collectively in law enforcement across the country. Here locally, as you can see on the screen, Essex County, we're located just north of Boston, up on the North Shore, between Boston and the New Hampshire border, 34 cities and towns. It's a population of about 789,000 residents. Here in Essex County, our jail population last year averaged a little over 1,400, about 1,449. With COVID and the courts and the moves up, particularly up this way, I believe it's across the country too, to depopulate our correctional facilities. We're down. I think our population today is 1,024, so we're down 400 or so, which isn't a bad thing. I got to be honest with you, and I'll get into that in a few minutes. But obviously, our top priorities, like my fellow sheriffs, public safety for the residents, and obviously providing secure and fair treatment for all our inmates as they come and go. And we're looking for innovative ideas, evidence-based practices. I love that word, those words, data-driven projects, so we can put our ideas and programs out there and measure them somehow, so we know that we're doing something right, especially when we're spending somebody else's money, like in this particular instance, there's grant money. One of the things I'd just like to start with and give you a real just quick history of myself, as I said, Essex County, 34 cities and towns. The largest city in Essex County is the city of Lynn. I've been sheriff coming up on 4 years now. Prior to that, I did 32 years with the Lynn Police Department, coming up through the ranks, and I served as chief the last 7 years. One of the things I learned there quickly, and I believe Sheriff Lemma mentioned it, in partial sentencing, but when you look at the root causes of crime, mental illness and substance abuse are both strong factors in what drives the bus, so to speak, when people go out and break a law. And it's a lot of times both in these individuals are suffering from co-occurring disorders with both of those issues. And up here in the Northeast, we got hit very hard with the opioid crisis. So that's a major factor in what drives our crime rates and the quality of life reductions in our community. So as a chief, I learned that quickly. And just to get off topic a little bit, while I was chief, we implemented a program in Lynn called the Behavioral Health Unit, where we brought in civilian clinicians and caseworkers, embedded them in the police department, introduced them to the police officers, enabled them to go out and do ride-alongs with the officers on their respective patrol routes. And I've always said any cop worth his salt or any sheriff worth his salt knows the good guys and the bad guys on his or her patrol sector. And that's true, especially in cities like Lynn that are busy communities. So when you know the people on your route, if you see somebody that's in crisis, especially in the mental illness field, you can see it coming. You can see something's going to happen. So the Behavioral Health Unit was huge as a preventive measure. So if an officer saw, say, Kevin Coppinger look like he's off his meds and he's doing some abnormal behavior, the officers would bring the mental health clinician out to speak to Coppinger and hopefully get him back on his meds, or get him into a mental health facility, or even just go see his providing physician The point being here, you're getting the individual treatment and services before they enter the criminal justice system. They're not going into the local police lockup. They're not going into the courts, leaving those two entities free to do other services that they need to be doing and not really servicing the mental health if we have better alternatives before the criminal justice gets impacted. And you're doing the individual a service too, a good service, keeping them out of the system and getting the treatment they need right away. So that kind of, to be honest with you, that kind of drove the bus for me to become, or try to run for sheriff, back in 2016 with that idea, because I think that's what really drives our crime reduction initiatives here in Massachusetts, and I can speak of in Essex County. So when these grants came along, next slide, please. One of them was before I became sheriff, that 2014, the Mental Health Diversion Planning Grant. Now, I wasn't here, but because I was the chief in Lynn at the time, I was part of that, planning mechanism with the previous sheriff. So what that did was that gave us some money to go out there and figure out how we're going to do this and what's the best way to spend these dollars. And we created, or the previous sheriff created the Essex County Justice and Mental Health Task Force. As I said before, the Lynn Police Department was on it. Other police agencies in the county were on it. We brought in mental health clinicians, substance abuse folks, people who are really in that business that can put their collective minds together to come up with a good plan and solution to how do we address these mental illness problems we have. And that's what's now bringing folks into our jails and prisons. And going back to something else I learned in my few years of law enforcement, when someone doesn't know what to do with something and an individual is acting irrational, they dial 911 and the police come or the sheriff comes. And sometimes they don't know what to do or they don't have any other options. So the handcuffs come out and the individual gets arrested. Then they bring him into the court. And sometimes the courts don't know what to do with them because they don't have the resources nor the expertise to do something with them. And then they end up in the jails. And they come to the jails. Traditionally, the jails, the traditional role of care, custody, and control kicks in, and nothing gets done. So what we're trying to do now, and this grant helped us a lot, is change that mindset, change that culture of what we do in the jail, and come up with these services, working with the courts and some of these other folks, like this Essex County Justice and Mental Health Task Force, to find out how do we best serve these populations, so we can do what we can with the individuals while they're in our custody, and upon release, working with the court system and the individual agencies that work there, come up with a collective plan. So when we do our reentry piece, get them back into the communities, they don't come back and see us in the jail. They don't reenter the criminal justice system, and hopefully they become productive members of society again. They can reunite with families and jobs and whatever else and get back to a normal sense of life. So just going back quickly to the grants, as you can see in 2014, we got that first grant to Planet. It was a one-year grant. We worked very well with that. Applied for the second grant that we received in 2016, just before I became sheriff. 3 years at $250,000. We collaborated with the Volunteers of America, the Massachusetts chapter, which I have to say, they've been a huge help to us here on a number of issues. Working with this grant was tremendous. One of the things we came up with was a brief mental health screening at intake. So when all these, we average about 9,000 intakes a year. And so when we bring somebody in, they go through this brief mental health screening just to see what we have. Is there a need of services, and how do we address those needs? That's been very, very successful. Once the brief screening is done in intake, the information is handed over to our clinical assessment team, where it's diagnosed, and then from there they'll start to formulate the particular services needed for that particular individual. Diversion programs are huge. All of our cases here that we're talking about are all pretrial. Up here in Massachusetts, it's probably close to 80% now, 75 to 80% of those we have in custody are pretrial, and the others are sentenced. So that's a majority of our population. So that's really what we're looking to hit here with these grants. So again, when we have them in here, we're putting together these programs. We created a pretrial mental health diversion unit where these clinicians go in and work with these individual clients, come up with those individual treatment plans. Go back to the courts with that, working with obviously the judges, district attorney, probation, parole, local law enforcement, defense counsel, any clinicians that work within the court, to present a plan that hopefully we can get the individual released with some type of conditions, whatever the judge wants to put on the individual, he or she, and then make sure, and this is critical, make sure we have those links with the outside resources in the local communities so any needs for the mental health treatment follow-ups are done. And again, I'm going back to that task force. That's why that's so important, because those individuals are at the table. They know what we're trying to accomplish. They agree with what we're trying to accomplish, and they're part of the team, the collaboration and partnership. And they're not all there, but those are like the larger agencies. So somebody may go back to a smaller provider, but that's fine. But as long as they're getting that, and then the court, usually probation, will follow those individuals, making sure that they're complying with the treatment plans that we put together with the courts and the judge authorizes so they can stay out. Now, sometimes that might mean they want a bracelet. Okay, that's fine. We can live with that. We have 3 offices of community corrections, which are day reporting facilities where a lot of programming opportunities are available. So the individuals may get assigned to the OCCs. They're living at home. They could be still at their job or wherever, but they report to the OCCs in a predetermined schedule to get some of the services there, again, depending on the individual program. Next slide, please. So we recently, last year, we got the larger grant, the $750,000, to expand on what we have. This is a 3-year deal. And this increase, let me back up a little bit. That middle grant that we got for the $250 gave us 8 beds inside the facility here in Middleton, which is our main campus. And we were servicing, we estimated about 88 individuals during that time. This new expansion grant moves us up to 40 beds, 30 for men and 10 for women. And we're hoping to service about 450 individuals there during the 3 years. We had done this before, teaching all our staff mental health first aid. And again, when I was a police chief, it's the same philosophy. If you, in my opinion, if you teach your officers, whether they work on the streets or in the correctional facilities, mental health first aid, let them understand it. Let them learn about the signs and symptoms of somebody that goes into crisis. And teach them the skills to de-escalate. That's the big buzzword of this day and age, especially where law enforcement is under such close scrutiny across the country with dealing with mental health cases. Just look the last couple of days what happened in Philadelphia, where the individual allegedly had some mental illness, and there was an altercation with Philadelphia PD. What I like to tell our staff is, we pay you to control, not to fight somebody. And oftentimes your greatest tool is your verbal skills, able to talk people down off the ledge, so to speak, with these de-escalation skills. So you teach your staff mental health first aid. That way they understand and they can see some of the individuals, again, whether they're in jail or out on the street, and talk them down. And then you get the mental health folks there too to respond, and you can take care of that person much easier than wrestling on the ground with them and where people get hurt, and that's never a good outcome there. So we've done that. We're also, this next round of grants is going to help us increase training. Trauma-informed care. That's another big one. A lot of these individuals are here for whatever happened during their life with the trauma. When a person goes through whatever trauma it may be, maybe they were a victim of sexual assault over the years, or human trafficking, or some other, horrible crime, and then they're in here, something could trigger some of these mental illness responses. So if the officers understand, again, what their trauma-informed care could be, it just helps them deal a little bit more. Now, don't get me wrong. I'm not the ultra liberal here, trying to make my correctional officers and the police officers in my county social workers. But there's a dual role you have to have. You have to have a secure facility. You have to be able to control it, but you also have to understand those root causes of crime. Again, mental illness and substance abuse and the co-occurring disorders, they're a huge, huge thing. We have a very big medication-assisted treatment program here in Essex County. Started a couple of years ago. Where we now have a dispensary we built out last year, state-of-the-art. Actually opened up earlier this year, pre-COVID, back in February. We are giving Suboxone, Methadone, and Vivitrol on a daily basis. Our average count is around 140 inmates per day are dosed. This has been really something that's helping us out to control that piece of the puzzle too, and it's working. This grant also helps us pay for the recertifications for the mental health first aid assessments. We have those critical incident teams that I believe Sheriff Parkinson mentioned before. We do something very similar here too, and we're in the phases of giving naloxone to inmates as they leave here. So next slide, please. That might be the last one. I'm not sure. Yeah, it is a lot. So just in conclusion, because I don't want to speak too long, I can be very long on these things, but our program, like a lot of the other sheriffs, it's 360. It's hopefully they never come in here, and we're trying to work with the communities to share information especially when we do releases, so they know these individuals are coming back to their community, so they know it. And like the behavioral health unit, and then they work with them to get them treatment outside the criminal justice system. But when they come back in here, we're doing everything I can collectively with our criminal justice partners here in the jail, our private vendors that help us with the mental health stuff, the local law enforcement, the local social service agencies. And this reentry piece is a key. It's got to work. You got to work with your local cities and towns, both the government and the private entities that work in those towns. You got to lead the inmates to those services and show them where to go and put them in touch with them, so that they get out of jail, they get out of here, makes our job easier, reduces crime, and hopefully it improves our society. So that's it. I thank you very, very much.
Great. Thank you so much, Sheriff Coppinger, for that overview and for really telling the story of these different initiatives and these different JMHCP grants and how they build upon each other. So now Carrie, Hill, and I are going to take turns asking the sheriff some questions. And so we're going to ask a few general questions and go down the line, and then we'll ask some questions specific to each sheriff and to each of their jurisdictions and their programs. And then towards the end of the webinar, for about 15 minutes or so, we'll have time for questions from the audience. But to start with the general questions, the first question I have really takes us back to the start, figuratively, of identifying an unmet need and identifying service and programming gaps. And so my first question is, why did you and your teams decide to apply for a JMHCP grant? And let's take things back to Sheriff Parkinson, if you want to take the lead on answering this first.
Certainly. So I kind of mentioned at the very beginning in my portion of the program is that we identified that we had an issue, and we certainly recognized that we didn't have all the solution to the issue. And when we decided that stepping up and the structure of what the grant offered was a good way of starting, we became obviously very interested. We had a lot of providers, different providers that were really siloed throughout the county that did provide services, but they weren't on the same page. And so in the short of it, this allowed us to really focus on a strategy and move forward to collect the data we needed that was so vital in moving forward to identify any successes or any issues that we had. So it was really driven by trying to get everybody together and really operate off the same sheet of music and have an implementation plan. So that was really the driving force behind us wanting to apply.
Great, thank you. And then either Sheriff Lemma or Sheriff Coppinger, do you want to weigh in on why you and your teams decided to apply for the JMHCP grant?
Yeah, I'll weigh in. One of the things that we've talked about here is to recognize that treating the underlying conditions that lead people down the path to commit crime in the first place is the space that we could be most effective in, not only from a traditional criminal justice perspective, but addressing recidivism and reducing the likelihood that children would engage in maladaptive behavior later in life. Unfortunately, that is a paradigm shift when it comes to most criminal justice organizations. And as a result, there has not been adequate funding to support those various initiatives, or at least to gather scientific evidence that supports how effective these strategies could be. So for us, having that initial funds in order to do that, then taking empirical evidence and persuading others to really invest not only with time and effort and energy, but with money is the exact reason why Walmart and the hospital chain has said, you know what, this seems like it's working. And it really started going down that path because we had the resources in order to move forward.
And I'll just jump in on the end of it. Both sheriffs explained, great reasons, and I completely agree with them both. The other missing piece that I just like to add would be, there were a lot of agencies dealing with the mental health clients in our communities, and there was no bringing them together. So everybody was kind of doing their own thing, and sometimes individuals were being treated by multiple providers, and there's no collaboration there. So when I got here, as I mentioned before, this grant was the task force was put together, and then these grants became available to expand it. We really made sure we geared it towards bringing all those players to the table as much as we can, working with local law enforcement. A lot of the agencies do the same thing. So it just seems it's a much easier or a much more direct treatment that's being given to the client, so to speak, when you have a unified, almost like a unified command in an ICS situation. You have a unified group that's providing the services to these individuals, so they're talking together. Because it's not all going to be perfect. We're not going to have all successes, but when we have those failures, we can collectively talk and find out what went wrong and how do we fix it next time.
Great, thank you all. And then Carrie, do you want to go ahead with your question?
Thank you, Mark. Well, first of all, good afternoon, everyone. And for those of you on the West Coast, good morning for about 9 more minutes. I would like to first thank you, sheriffs, for all of you being on taking time to really talk about the programs that you all are truly champions on. And the beautiful thing is we've heard about different ways with the initiatives that you are each working on a mental health initiative that in some way is supporting, a little bit different in each one of your sheriff's offices. And as champions, we all look to you when we see these successful programs and ways that you continue to advance and move, and it's incredible. But I also know there are also some great lessons learned, because what starts out, at the end going, wow, this is incredible, and we would love to do that. But as you started this and as you've evolved, what were some of the lessons learned, and what might you do differently with your grant? Because that's always helpful too, so that others who are looking to replicate maybe might do that differently as well. So maybe I'll start with Sheriff Parkinson.
Well, thank you. I would say I'll answer the last part first, and that is, what would we do differently? And I will say nothing. I wished it moved along faster and it was easier, but I think the lessons we learned along the way really boiled down to kind of navigating a system that none of us were particularly familiar with. So when we talk about data, I'd mentioned earlier about HIPAA concerns, California concerns with their laws. And really a third portion of that was really the interpretation of what those meant. Early on when we started our CAT team, our community action team, and our deputy was partnered with a mental health therapist, it was kind of a frustrating moment, because trying to get even them to share it, I found was open to interpretation by mental health. I said, well, they're out there for the care of this particular person. They should be able to share. Does this person have, a criminal background, or does this person have a mental health background? And I ran into resistance. Fortunately, I think going through this process really helped tremendously building the trust between agencies. Because when we set out to do this, and we're talking about, information, coming from the sheriff's office, probation, health agency, behavioral health, the district attorney, and the courts, we had to pull all that information together, and everybody kind of had to trust one another. And we put in a system that we called Switzerland, where we identified the people that were going to really gather all this information, identify it, and be able to disseminate it. And so we had to go through a process of basically empowering them and certifying them to be able to look at the data. So when it comes to criminal data, we had to make sure that we were in compliance with state law in allowing this person to look at that data. And same with the behavioral health side of it, and the health side of it, and court side of it, all that. But once we did that, that was our biggest challenge. And so it boils down to, relationship building, trust building, staying focused on the the purpose of what you are doing is for the health and safety of these individuals. And it's not a traditional law enforcement model. I think Sheriff Lemma had actually mentioned something similar to this, but we're stepping outside of what we normally do. And even though we've been doing it for some time now, in a way, this was a real coordinated effort. So I would say it boils down to, you have to build those relationships and you have to build that trust, and you do that from being, or by meeting and by discussing the needs and focusing on the needs of either the inmate or the person out of custody that could be was a past inmate or could be a future inmate. And I think once you break down those barriers, I think that's what leads to success. And so, that I think if I did it all over again, we would do it the same way, but we know so much more now than we did then when we got started that it would be probably a much smoother process.
Thank you. And one of the things I really appreciate that you've talked about is that data sharing, and that's not easy. And it's actually one of the challenges that many experience throughout the United States. And how do you do that? So I applaud you that you found your way to do that, through relationships and trust, like you mentioned. So thank you. All right, Sheriff Lemma, how about you? If any lessons learned as you walk through this grant, or anything you would do differently?
Yeah, I think that those are wonderful comments, and I agree with every one of them. I think collaboration is a big part of it. I think as sheriffs, we have a responsibility that extends beyond our individual agencies. I think that, we're uniquely positioned to leverage every aspect of the criminal justice continuum to advocate for things that actually work. That collaboration means, members of the state attorney's office, the public defender's office, typically our chief judges that are going to embrace like problem-solving courts and those types of things. And, in retrospect, what I probably would have done a little bit more is to court in some direct buy-in with philosophy of all of those individual stakeholders, like the school boards and the DCF workers and all of those individuals. Although they did not provide any resistance at all, I realized that I automatically moved down this path and basically said, hey, here's what we're going to do, and we want you to support that. And I think if I would have maybe courted that relationship early on, it would have been a greater personal investment in the process. We haven't had any problems with it, and there's been complete buy-in because they've seen it work. But the recommendation and guidance that I would give is on the front end, we can't be so busy driving that we don't stop to get gas. So having some of those initial conversations with other stakeholders goes a long way when it goes to implementing a new program and or strategy.
Thank you, Sheriff Lemma. And, you talk about, again, that collaboration and that relationship building. And part of that, as you mentioned, getting that philosophy on the same page. And part of that's listening, back and forth and that communication. And your passion, I know, especially for, for the juveniles and that mental health piece is so well known. And so that even though you may have been driving that bus, I think everyone, because of that trust and the relationship, I think that's why you've had such incredible success. But again, great advice, for others as they move forward. Sheriff Coppinger, what about you? What about some of the lessons learned? And you really bring to the table, it's really a nice breath, because you come not only from the police side of the house, but also that correctional side of the house, and somebody who's been sued, and somebody who also has now one of the leaders in providing not only medication-assisted treatment, but also that focus on mental health. What are some of the lessons that you've learned along the way, from your grant?
I had to laugh, Carrie. I don't know if everybody knows it. Maybe a lot of folks don't. Carrie and I go back and forth. We have kind of a private joke here that we'll share with you. But I mentioned we have a medication-assisted treatment program here that is very rigorous, and it is working, I have to admit. I was sued a little over a year and a half ago by the ACLU and a couple other groups. The case is called Pesci versus Coppinger. I'm just hoping it never becomes as popular as Miranda versus Arizona. But in a nutshell, the ACLU picked 3 cases across the country, one in Maine, one in Massachusetts, and one out in Oregon or Washington. and mine was the one that actually went first. So that's why I have the medication-assisted treatment. Maybe that's an offline conversation. If anybody wants any information about it, call me. I hate to say it, I've become an expert in that because of that case. But staying on this topic, for going back to this, lessons learned. And I got to say, I guess I learned this with the Pesci case too. Two things: be willing to take a chance and be open-minded. When I gave my intro about Essex County, I mentioned the daily population. A year ago, we were like 1449, and now today we're at 1024. So roughly, we're 400 inmates shy of what we were or what we have been the last several years. And that's a lot of it due to COVID. And again, a lot of these groups that are trying to get people, released from jail for a number of reasons. But the good that came out of that was we were able to create a special pretrial diversion housing unit. We call it COPE, Correctional Opportunities for Personal Enrichment. And I got to be honest with you, when it was first presented to me by some of my staff who are much smarter than me, it was an idea I kind of cringed at, because they were going to take individuals who we traditionally would have locked up in a hard cell. And some of these guys were in protective custody for a number of reasons. And they want to put them in a dorm-style unit under this, obviously care of mental health clinicians with correctional staff there for the safety and security of it. So I listened to them. They made good arguments, and we gave it a shot. We created in the new unit because of the reduction in population. I had some extra space. It is dorm-style. We moved the mental health clinicians right on the floor with them, so they can interact with them during the day. And there is this private meeting room that they have to have a one-on-one, but they can interact with them during the day, and they can actually physically observe all 30 people at any given time in case anybody starts to go into crisis. And it's working. It is still early, but it is working. So to me, again, be open-minded. We'll think outside the box, be willing to take a chance. That seems to be the way it is. The mental health experts are telling us some folks, after they do these individual assessments, will do better in a group setting. They do worse in an individual cell or in a cell with just one other cellmate. So, hey, I'm a law enforcement guy like the other sheriffs here, and I'm listening to the mental health experts. That's what their suggestion is. I went with it, kept my fingers crossed, and so far, so good.
Thank you. Yeah, thanks, Sheriff Coppinger. And I think that lesson learned, though, is being open-minded and listening, and not only listening to your staff, listening to, the mental health experts. I know Sheriff Parkinson talked about that. You have your staff working inside even the mental health kind of unit, and they have new and creative ideas. And so sometimes that thinking outside of the box gets us to where we are today. So thank you. Back to you, Mark.
Thanks, Carrie. So my next question really gets at the collaboration piece. And my question is, can you give some tips for grantees on the line who would like to have their sheriff's offices more involved in their grant? And you mentioned a little bit before, I think all of you did, about how sheriffs really are key for supporting these programs. And as the technical assistants or TA coaches, we see that barrier come up as well over and over again across grantees that might not have their sheriff as involved as they would like to be. And so what are some tips or strategies that you would give to grantees on the line about how they can get their sheriff more involved? Sheriff Parkinson, do you want to start?
Certainly. I'll start with saying this. Even though we might fool you sometimes, sheriffs don't always know the answer. And we don't always see everything. And so, I think Sheriff Coppinger had mentioned his background. I came from 27 years in the police department. So, coming into the sheriff's office now with my 11th year, I had a lot to learn. I had it easy in the sense that I didn't have all these other responsibilities at a police department. So I think education is extremely important, and you're going to have to get creative if you're struggling with FaceTime with your sheriff. And I would suggest this: collect as much information as you can. We deal with budgets, we deal with manpower, and I think understanding that the amount of time it takes to deal with this population within your jail for your male and female custody deputies is enormous. And so that will register, I think, with most sheriffs that, we could save time. We'll have less issues with these inmates if we are dealing with it properly. And certainly we want that as well. The other thing I'd suggest is, utilize, us, other sheriffs that have done this to help sell the point, because I can tell you, we didn't know what we didn't know going in, other than the fact that we knew we had a problem. And I think as we've gone through this process, this fluid process, and learned, it's been a really learning experience for us. We went from having the county do our mental health and medical to being able to take that over ourselves. We contract out with our medical services, but now I have a full-time compliance officer that that focuses on issues, and then I have a full-time chief medical officer who doesn't see patients but has overall care over inmates in custody and has oversight over our healthcare provider. Never imagined that I would be there, and so things change, and I think learning from others is key. Right now we have other agencies that come into our program and want to use us as the model for their program, and actually copying our model directly. And these are agencies that are a lot larger than us with their jail population. So it doesn't matter the size of the agency. You can learn from them and use those ideas to help convince your sheriff if they're not on board. Sometimes it's not the sheriff. Sometimes you get roadblocks in between, but that message has to be delivered as to the importance of it. And I think to the most part, they should recognize that. And I think when you're presenting other models that are successful, I never thought, we received the Innovator Award because, we have people that are working diligently on improving what we're doing and following stepping up. I know I have one of my employees, probably multiple, but Jessie Yates is on, that she works full time on this. And I think having that base knowledge that you can actually draw from and share in your agency you're going to be a step ahead of us. When we began, we might have had a desire, but we didn't know really where we were going. And it took a collective group of really dedicated employees that pushed us to that direction. So utilize that, ask and use that to help convince.
Thank you, Sheriff Parkinson. And then Sheriff Lemma or Sheriff Coppinger, would you add anything to that?
Yeah, just in the interest of brevity, not to repeat, but I think that it's incredibly important that we embrace the philosophy of there's not one of us that's smarter than all of us. And going through this process creates kind of a great advantage of being able to advise others that may be navigating the process. Sometimes when there's some new opportunities, it is perceived as intimidating, or the results of that are maybe in question. And I think that by reaching out to somebody who's already gone down the path, it makes the work much, much easier to talk about the successes, to actually include that as a part of the process. But, again, I encourage everyone to do that. Reach out to any one of us. I'm sure that, we or our teams would be willing to share anything that we have about this wonderful, wonderful partnership and success. And I think that in today's environment, we need to benefit from as many of these opportunities as we possibly can.
Quickly, same thing. I'll be brief. Both sheriffs hit the nail on the head right there. I completely agree with both things they said, everything they said. And just simply put, if you're going to put together a working group or an oversight group, just make sure you give anybody you want to, give them a seat at the table and ask them to come with their ideas and their thoughts and to listen to them. And hopefully they will listen to others too and bring us on board, bring any of the other groups on board. But sell it that way to anybody that you might not think will be 100% on board, because I think when they hear the information that's out there, they will soon be with you.
Great. Thank you all for the advice. And Sheriff Coppinger, I have a specific question for you. So when you were discussing the different JMHCP grant awards that the department has had over the years. You really told the story of how each grant program builds upon the next one. And my question is, how are you measuring success? I know you mentioned a lot of different initiatives in terms of training and even the medication-assisted treatment program. So how do you measure success?
Very carefully. How's that for an answer? We actually contracted with an agency to come in and help track all this for us. The DSM-5, which I believe most folks are familiar with. I put my glasses on to read these things. The CAPE 5, LSCMI, and the MSDP. I got to be honest with you, I had to refresh my memory this morning on what all those terms mean. But basically, those are mechanisms to track what you're doing with the individuals, what their needs are, everything from psychological to addictions to family matters, educational, employment. It's the whole package when you look at the individuals. We're also tracking it with recidivism, and to me, that's a very tough thought process to actually carefully track. We look a year out to get our recidivism rates. I think most agencies do, so we're still a little early on that one. And it's kind of, depending on how you define your recidivism rates, it's difficult to do so. But bring somebody on board that's an expert in measuring success, and that's what we did with our Dr. Calkin. She takes this data, she looks at it for us, and she gives us a report. We just got one a little while ago. We are making success. We have successes. Are we perfect? No. But no program is, especially when it just starts out, but we're learning from that. But if you don't have the data and you don't get the data right, you don't know really what you're doing. So and we're lucky to have those folks there. We're lucky it's paid for through the grant, and we're working very closely with our the data analytics team to make sure that we can get as much data as we can. Again, working with the courts and local law enforcement too to get all the data available and then analyze it at the end of the day to see what we have and how successful we are or how we can improve it, even more important.
Thank you, Sheriff Coppinger, and one of your fellow sheriffs here. I think when you talk about data, Sheriff Katusian's line is always, a vision without data is merely a hallucination. That data piece is so very important. So thank you. So Sheriff Lemma, I have a question for you. You talked about some of the trainings that you've been doing and you put in place for your staff as you were working on the grant. How has that helped, and can you talk a little bit more about that? Because I know it's been really a key for you.
Yeah, absolutely. So I think that there's two really groups of individuals that we've been working with. The first one has been a little bit more difficult because, I like to say that sometimes we have the habit of becoming occupationally institutionalized to a set of practices and principles and philosophies that we've done for many, many years. And with that group, it's really the whole who moved my cheese type of philosophy of saying, look, if we address these social issues during the most infinite stages, we can have the greatest impact on not only crime and victimization, but quality of life of our community and ultimately save lives. So there's a little bit of a different strategy when it comes to talking to the already existing law enforcement officers, because many of them have many, many years. They come in sometimes with the mindset of, hey, this is somebody else's job. And then somewhere along the path, the role of a criminal justice professional has changed. Now we've become smarter, we've become more informed, we've become more sophisticated on what actually works, and the data has driven us in that direction. Not hypothesis, but the data approves that. So that is a little bit more in intense training. It is facilitated by somebody who has a higher level of traditional credibility, meaning that somebody who's been on the job for longer and now has helped with changing this philosophy. The second aspect of it is newer people coming in. And I tell you, I am incredibly excited about the new people that are now coming in and being recruited and walking into this business with the sincere desire to help individuals and help people. I think that they recognize that sometimes the most glamorous and sensationalized aspect of criminal justice is the apprehension of the offender. Many of the agencies recruit people to their departments by SWAT team photographs and the aviation helicopters flying over. And when they arrive, they realize that that's just a small percentage of what we actually do. So getting people from the university, getting people who really subscribe to these core fundamental concepts has made it much easier to train and orientate them. And then it's important that we also reward their successes to celebrate, because there is a biological effect that occurs when you can help somebody. You get those endorphins going, all that. And we have correctional workers or people who are working in enforcement positions with our juvenile section. When they quite literally see somebody's life transform in front of them, they walk away and say, you know what, I feel pretty good about myself. I feel like I'm making a difference, and they want to encourage that behavior more and more. But I tell you, if it wasn't for the training and if it wasn't for slowly courting people down this path, I think that some people would be reluctant. They'd say, hey, point fingers at somebody else. But we've had wonderful success with it. And from those most seasoned veteran members of our agency that served on SWAT team and did all of the macho aspects of traditional law enforcement, have now really embraced this concept and philosophy.
I just appreciate it. And each one of the sheriffs has talked about it, whether it's that crisis intervention training or it's that mental health kind of training officer. But what you're talking about, we have seen it across the board. And I appreciate that each one of you touched on it. So I know it's a significant priority for each one of you. So thank you.
And then I have one last specific question for Sheriff Parkinson. So earlier you mentioned how with previous practices, the can had been kicked down the road and it ended up with you. And I wondered if you could tell us a little bit about how you hit reset on those practices and put in place the building blocks for your current practices.
So back in 2017, about 4 days after I attended the Stepping Up seminar up in Sacramento and was really kind of sold on this is the direction we wanted to go, we ended up with a jail death. And I mentioned that previously we were run by our medical and mental health were run by the county. So essentially there was 3 people in charge of the inmates in custody, behavioral health, medical, and the sheriff's office. Posed a lot of problems, and I recognize those problems, back when I came into office, that it was difficult to kind of be on the same page with 3 chefs in the kitchen. But nonetheless, moving forward, we were pushing for a change, but we weren't quite there. And after attending the Stepping Up seminar, I came back and we had a jail death. That was a SMI inmate that was very violent, in and out of custody for a number of years, was injuring himself and had to be restrained. And he remained restrained and really had lack of I'd say coordination between medical, mental health. And so we ended up settling, the county settled that case, but under the health aspects of it, really medical malpractice. But there was a huge issue moving forward is how are we going to change this? So having, when I mentioned kind of blowing up the system, that's more or less what we did. We had an outside consultant come in, take a look at our model, make some pretty solid recommendations. I had discussions with the county CAO because recommendations are great, but when there's money involved, they become a little more difficult. So getting the CAO on board, the CEO agreed. The model included what I mentioned earlier about having a chief medical officer, and they actually wanted to move forward and allowed that as the first step to hire Dr. Mulcairn as our chief medical officer. And then we set on the road of contracting and what we wanted. And we entered it, I think, with really a very wide open or eyes wide open mindset that mental health was a huge component in it. And so everything that we needed in order to eventually move into what we are today requires, data from the healthcare provider, requires, a lot of stuff. I think Jesse has talked about it before about identifying it's great to have all this data, but how are you going to measure it? And so all that went into play when we kind of rebuilt our entire system. And, going from probably I'd say a jail under high scrutiny to a jail that I think has become a model where we're having other agencies come in and see it. It's really, all new. It was all new. And I think one of the sheriffs might have been Sheriff Coppinger mentioned, there is no perfect system. And there never will be, because it's ever changing and you have to evolve with it. As soon as you sit back and say, we've got the best system and, we got this handled, something gets, stuck in the spokes, and you realize that you're back to trying to figure out how to fix it. So I think having a really proactive staff and identifying issues and really focused on kind of the big picture is the model that we kind of turned into. So, expect change, expect to constantly be looking for new ways of doing business. And I think the model that we landed on as a product of, a lawsuit, but also us being able to redesign our system has really proven to be very successful in the steps we took. Unfortunately, it took a tragedy to do it. But the reality is sometimes that's what, causes change. And so I think for us, not only am I satisfied with the model we have, I'm also satisfied that my people are not satisfied, and it's a day-to-day change that you have to be willing to embrace. As the other sheriffs have said, that you need to be able to say, today's model is not good enough for tomorrow. And so it's focused on that, and focused on trusting your people and trusting the fact that you shouldn't be satisfied. And I think that is where we began in such I'd say somewhat a dark place and ended in such a bright place, and continue to go that way is kind of where I feel we have changed our whole outlook and paradigm.
Great. Thank you for sharing that, Sheriff. It's a powerful testimony to how one incident can really drive systems change, and how, as you said, that today's model isn't good enough for tomorrow, and how you're continually building and refining on that model. We have a little bit of time for questions and answers from the audience, and we've had one or two questions come in. I'm going to start with, sorry, I'm pulling up the question. It seems that all of the sites have added staff. What happens when grant funding runs out? What is the sustainability plan? I'm not sure whichever sheriff wants to hop in and take this first.
Yeah, I think that's a big part of any time you partner with a new grant opportunity. You got to think about sustainability. I think that kind of the spirit of grant funding is to really get you kicked off and started in a new direction, and I think that you have to be kind of mindful of what you can do to sustain it. And let's face it, I mean, if it works and it results in the reduction of crime and the enhanced quality of life, or it's saving lives, I think it's easy to justify a sustainability plan. The larger agency that you have, obviously the easier it is to do that. Our annual budget here is about $145 million, so me absorbing some positions and continuing things at work really amounts to reprioritizing. I think that it's incredibly important that we as law enforcement executives and professionals look at the way we've done business in the past and the way we're doing it now, and let evidence drive our decisions as where we put the majority of our resources. We know that a lot of people shy away from what they don't understand, and mental health is at the top of that list. And I think that when you look at the most recent numbers, know that 20% of the population suffers from either a diagnosed or undiagnosed form of mental health. And if you look at the most recent stats, about 25% of people under the age of 18 have seriously contemplated suicide within the past 12 months. And I think that that's some of the unintended consequences of COVID-19. So sustainability is an important part of what we do, but if it works, I think it will stay.
I'll just add something. I absolutely agree with Sheriff Lemma. I would add that make your program a program that the people that decide where the money goes cannot do without. This is a hot button issue right now. The more you educate them on the value of what you're doing, the harder it is for them to not support the program moving forward. It might be in a little different model simply because of finances, but if you're not selling the program and selling the benefit of it, then you're going to be challenged. We all know when money runs out, but if it's a program that is truly beneficial to you, that you enjoy or you like, as opposed to one that's a true benefit to the community, and that your electeds, if they're deciding your financial budget, politically, they're not going to be able to do away with it because of the benefit that it is doing for the community. And so that incumbent upon you to highlight your program the best you can, educate your people, keep them involved in the community as best you can, and help convince those people that the money needs to be there. And then, and from my position, if they were going to cut one of my, vital positions for this program, I'm going to figure out how to change that. I'm going to figure out how to shift around money in my budget to keep it alive. And that's always possible, depending on the size of your agency, that's for sure. But you can make decisions that, keep it going and keep it alive if the money is not coming from the county. There's always a way if there's a will. So
I think both sheriffs just hit the nail on the head. I would just take it one step further. Sell yourself, sell your program. Invite your elected officials in. One thing I've learned in just the 4 years I've been sheriff is a lot of people, especially those that control the budgets, really don't know what we do in our correctional facilities. They hear rumors, they hear it from the other side, those that want to condemn our jails as the houses of horror or whatever else you want to call it. But invite them in and accentuate what we do good, and take them in for a tour. Hopefully COVID doesn't get involved, but bring them in and show them these programs in action. Allow them to talk to some of the inmates, so they can hear it firsthand. So we do get the money, like Sheriff Parkinson said, and identify those things. The other thing I'm hopeful to do, where we have this pretrial diversion, where we're trying to get them out, is take those dollars and put it right back into the program. So if I might lose grant funding down there, if I can get bodies out of here, it might help offset the deficit that might create when the grant money dries up.
Great. Thank you all for your answers. And then one last question is, what is the spark that helped you as law enforcement professionals recognize the need for a paradigm shift? We talked a little bit about some of the momentous things before, but is there anything else that you would want to add to that?
Yeah, I would think in the simplest way is what we were doing before simply didn't work. I remember talking to people, and I asked a group of seasoned veteran law enforcement officers, by a show of hands, for those of you who have been on the job for 10 or more years, how many of you have arrested the same person for the exact same thing over and over again? 100% of the people put their hands in the air. And I asked a room full of more seasoned veterans with 25 years or more experience, and I said, raise your hand if you're arresting the son, daughter, niece, nephew, or close relative to those people that you were arresting when you first came on 25 years earlier. And every person put their hand in the air. And I said, we've got to do something. We have to change our philosophy. We have to address these things. And again, crime is a symptom of another problem. And it's only by addressing those underlying conditions that are present where you can truly make long-term effective changes that extend beyond the CEO, that extend beyond the police chief or the sheriff. What we're doing now with these philosophies is changing the norms, customs, and values of our agency and profession.
just say, well said, Sheriff Lemma.
Great. Well, I know we're right at time, but I wanted to extend a big thank you to all of you sheriffs for joining us on the webinar today, for taking time out of your schedules and sharing your insights with us. And Carrie, thank you for being my partner in crime for tag teaming on the panel. So we did record this webinar, and it'll be made available to grantees. And feel free to reach out to me through email in case you have any questions, and I can route your question appropriately to the different sheriffs or to Carrie as needed. But want to thank you all again and hope that everyone has a great rest of your day.
Thank you.
Be well, everyone. Be safe, sheriffs. Thank you so much. Attendees, thank you.
Thank you all.